Good evening, everybody. Good evening. This is a little scary because I didn't realize I had 10 minutes and I'm going to talk very quickly. And the scary part is that I'm from New York, so it comes naturally to me. This is going to be really super fast. Okay. So really, I think that, everything that I've heard so far, I just want to basically agree with. I mean, I agree with the idea that we need to focus on better value. I agree with the fact that we need to focus on payment reform. I agree that we need to focus on outcomes. I think the real question today is whether or not 500,000 people getting health insurance through Medicaid expansion matters or not, and I would argue it does. Now, just quickly to say, this is really who we're talking about. We're talking about the area in the red. The bottom line is we don't have a healthcare system in this country for poor, low-income, uninsured people. We have a disability care program. The current Medicaid program requires, in most cases, individuals to be so disabled before they can get health care that could have prevented them from getting health care in the first place. The whole idea of the Affordable Care Act and the Medicaid expansion is to change that, and so we can provide early intervention and prevention-focused health care. Now, the main challenge that we have in many ways is that there is this other perspective. And the other perspective is that access to care is only a very small part of what it means to be a healthy person or get health. And while I agree that social determinants of health matter a lot, such as jobs, education, personal choice, and environment, in fact, healthcare access is a leading social determinant of health and makes a big difference in people's lives. Here's an example. When individuals don't have health insurance, they are less likely to participate in preventive care and more likely to delay medical treatment. When one is uninsured, it clearly increases the likelihood that we won't go to a doctor and we will either skip doses or dilute doses of much-needed prescriptions. Early access to care matters, and the bottom line is uninsured people with the same poor social determinants of health, the same social and health disparities, are less likely to receive medical care if you're uninsured than insured, more likely to have poor health status, and more likely to die early. I just don't have time, but bottom line is there are many advantages to having early access to health care, preventive health care, comprehensive health care, a primary care provider that works with you so you receive appropriate care, evidence-based prevention services. Now, you name the health condition, and early intervention makes a huge difference. That is what the Affordable Care Act's Medicaid expansion is about, getting people into care early as opposed to the traditional program. Now, I just want to point out, when you look at this slide and you see how much money we pay for health care in the United States, and there are clearly many factors for it, but the bottom line is social determinants of health and health disparities are not unique to the United States. They exist in Spain, in France, in Germany, in every other country to the same, if not higher degrees than we have here as a relatively wealthy country. What's different in the United States is that we have 50 million people uninsured. And really the question is whether we're going to make the investments, and they're sound investments, by reducing the number of uninsured here in South Carolina from 1 million people by 75% through Affordable Care Act interventions, part through the private subsidized health insurance, and the overwhelming majority through Medicaid expansion. Now there's this idea that expansion will hurt South Carolina, hurt the country by doubling down on a system that delivers some of the lowest value in the world. What's being missed here is that this Medicaid expansion is not the same program as our traditional Medicaid program. In fact, the entire Supreme Court decision to say that it's optional and that states couldn't withhold federal funding was because the program is so different than the traditional Medicaid program. If you look at the traditional Medicaid program, over 80% of that program is for long-term care and inpatient care. The expansion is not about disability care. It's about health care. It's about giving hundreds of thousands of uninsured South Carolinians, including many who are currently working and own small businesses, access to high-quality, comprehensive, and affordable health care, with an emphasis, again, on prevention and early intervention. It's not doubling down on the same program. And just to be clear, we are not just talking about poor people. We are talking about working people and small business owners. Increasingly, small businesses cannot afford to provide health insurance for their employees. If you work 40 hours a week, 52 weeks in a year, earning minimum wage in South Carolina, and your employer does not provide health insurance, you will be eligible for the Medicaid expansion. And for all of us, I am one of those fortunate people to have health insurance. I would just challenge any of you. Do any of you think having your health insurance doesn't make a difference in your life? It absolutely does. While I agree, again, social determinants of health matter. They matter a lot. Jobs matter, education matters, but so does access to health care. And just to be clear, being uninsured in South Carolina is not a short-term problem. The overwhelming majority of people that are uninsured, 75%, for 6 months or more. Now again, there's sufficient money in the system is one of the things we hear. We have to move from non-productive to productive uses. I completely agree with the idea of value-based insurance system. I completely agree with payment reform and getting the most bang for our bucks. But the bottom line is shifting resources from non-productive to productive does not help the 500,000 people that are completely left out of the insurance system that will be in the system, and we can provide productive health care to them. Just to be clear, South Carolina seems to understand this when it comes to kids. If you look at the investment here, South Carolina has disproportionately invested in children and not in adults. The same holds true for kids and adults. I applaud South Carolina for its efforts to increase enrollment and access for kids. We need to do the same thing for adults. And the failure to do it has actually moved South Carolina from 41 to 46 in the United Health Foundation's American Health Ranking Survey. The bottom line is we can definitely be more efficient, but we need to get people into healthcare as well as address social determinants of health. Now, I'm just quickly going through it. Again, as I want to say, I completely agree with value-based insurance design. I agree with the idea of trying to get as much as we can out of the system. Now, when it comes to healthcare reform, in terms of whether it's a good investment or not, now, when one wants to question whether it's a good investment for the federal government to spend, that's a whole other question. But for South Carolina alone, the overwhelming majority of this funding comes from the federal government. 100% in the first 2 years, 90% thereafter. And you can see that a $1.5 billion investment, for example, $250 million a year through 2020, will bring $2.25 billion a year into South Carolina. Now, if South Carolina doesn't expand, right, we will still have high rates of people that are uncompensated care. In fact, the trends are more people seeking those services. Built into the Affordable Care Act is the assumption that because people will be covered by Medicare, that we don't have to fund disproportionate share hospital funding as much. There will be a $463 million decrease in uncompensated care funding, but if you don't expand, then you will have increases in the number of people, and South Carolina will be even worse off than it is today. Finally, I completely agree that growth in the health sector should not be a goal of health reform. But while it shouldn't be a goal of health reform, it is certainly an incredibly positive outcome. The idea of billions of dollars flowing into South Carolina, increased business activity, tens of thousands of new jobs, means addressing social determinants of health. It is a great deal for South Carolina. And the final thing to say is, if South Carolina doesn't expand, what it means is that your tax dollars will end up paying for health care in New York and California. This is a good deal for South Carolina. It can make a really big difference in people's lives. Having health insurance matters. We certainly need to address social determinants of health and health disparities, but the Medicaid expansion and private subsidized insurance could by 75% reduce the percentage of people that are uninsured in this state, and that is an important step forward in this state. Thank you.